Now, new rules on COVID isolation come into force this Friday, with the time period to be cut from 7 to 5 days. And it comes as the Victorian Chief Medical Officer's advice to that state's Premier has been released, warning of more COVID waves in the coming months, resulting in high case numbers, hospitalisations and deaths. With more, here's Dr. Norman Swan, the host of the Health Report on RN and of the Coronacast podcast. Hi, Norman.
Hi.
So 5 days in isolation if you test positive for COVID but feel well. Also warnings from that the health system is going to come under increasing pressure from new COVID waves. How do you see the next few months panning out?
Well, if you take Brett Sutton's advice, so one of the disappointing things that's happened is that the Prime Minister chose not to release the scientific advice that he clearly, or the ministers clearly, the chief ministers received. So it's disappointing that it's still a secret what scientific advice they received. So interestingly, the Chief Health Officer's advice to Dan Andrews about their pandemic declaration is the closest insight we would get to what a typical Chief Health Officer might have recommended. So he doesn't address the issue of isolation, but one of the problems is clearly that people are no longer compliant. So a high percentage of a significant percentage of the population are not testing, and those who do test, if they're positive, are not reporting. So you've already got a significant group of people, but Brett Sutton's assumption was that if you actually relaxed a lot of the measures, you'd have the people who are volunteering to do that would drop even further. So what's keeping people reporting is the fact there's some level of public health and social measures going. But based on the best evidence, about 2/3 of people are still infectious. Now, even if you're slightly less, you've got a shorter length of time infectious with Omicron, let's say it's 50%. There's still a lot of people who are infectious at 5 days, which is why they've said if you're in a high-risk occupation, which doesn't solve the healthcare problem, so these are nurses, doctors, aged care workers, they're going to have to wait 7 days. And even them, 25% are going to still be infectious. There is another way around it, which I'm not sure, because we haven't seen the scientific advice, we don't know what they said. But rat testing is not very good for diagnosing this PCR, still the gold standard. But it turns out they're not bad at detecting whether or not you're still infectious. And there's a percentage of people who are not infectious at all at 3 days. But because we're being rigid about 5 days and 7 days, with rat testing, we might be able to get quite a few people back at 3 days. The risk you take, of course, is you're rat positive for a few days after 5 or 7 days and you can't go back. This is complicated. It's related to how much the public are willing to tolerate. The point that Brett Sutton makes in his advice to Dan Andrews is there's more to come. This is not over. New variants are appearing, he says, every 3 or 4 months, maybe every 6 months. And there's no guarantee that the next variant will be a subvariant of Omicron. It could be another one altogether more dangerous. And not enough of us have had our 3rd dose vaccine. So what's called hybrid immunity, the combined immunity of having had an infection and the vaccine, is declining, including against severe disease. And we need top-ups.
On to another subject now, an outbreak of what seemed to be pneumonia in Argentina, but now turns out to be Legionnaire's disease. Yeah,
so it was a bit of a mystery over the few days, 6 cases, 9 days. I think currently it's 11, the last time I saw the reports, of infection in both lungs. And some of the people were really very ill. And it turns out to be Legionnaire's disease. And the interesting thing about Legionnaire's, which actually I wasn't fully aware of, but Professor Raina McIntyre at the University of New South Wales has written a paper on this, is that we think of Legionnaire's, it's a bacterial infection that you catch from cooling towers. The water vapour carries the Legionnaire disease, Legionnaire's infection, and there have been infections in Australia. It turns out that probably internationally a more common route is drinking water, with poor water sanitation, that you can actually catch it from drinking water. Look, it's just a it's not a serious threat to us. It's just a message that in an advanced, highly technological country like Argentina, we are still fragile in terms of the infrastructure that protects us.
More on the Health Report tonight on RN at 5:30. Thanks, Norman.
Thanks, Ross.